So today for my presentation, we'll be looking at the ACL and the rehabilitation of ACL injuries. So some key facts for the ACL, or the anterior cruciate ligament. The ACL is one of the four main ligaments in the knee which connect the tibia to the femur, along with the PCL, the MCL and the LCL. The ACL provides rotational stability to the knee during movements such as cutting, landing and twisting movements. An ACL rupture or tear is commonly seen as one of the most serious sporting injuries, however they are still quite common. In the past, many people considered ACL injuries to be career-ending, however due to medical and technological advancements, most athletes today make complete recoveries. So looking at how ACL tears occur, they most often occur through movements like sudden stopping, change of direction and improper landings. These are what we consider to be non-contact ACL tears. The other form of ACL tear is a contact tear, which are most likely to be caused by tackles or collisions that cause the knee to bend in awkward positions. So looking at some statistics for ACL tears, so sports-related ACL tears occurred at around 51 per 100,000 people. There's around 100,000 annually in the USA, whereas in Australia we have about 15 to 16,000 every year. 70% of ACL tears are non-contact. 50% of ACL tears will coincide with injury to other structures in the knee, which is most often meniscus, but commonly the MCL is injured as well. Female athletes are at a significantly higher risk, which is approximately 8 times, of ACL injuries due to hormonal and anatomical differences, and teenage athletes are most likely to suffer from an ACL injury. So how are ACL tears rehabilitated? So for athletes who want to continue playing sport at a higher level, surgical repair is almost always advised, as a completely torn ACL cannot heal itself due to poor blood supply to the area. The torn ACL must be replaced, which is done most commonly by using a hamstring or patellar tendon graft. However, a donor or cadaver graft can also be used. This surgery must be followed by at least 9 to 12 months of intensive rehabilitation before a return to sport. Some athletes have returned to sport after around 6 months of rehab. However, this is often considered to be quite high risk and can lead to re-injury. In some cases, such as an athlete who has suffered multiple ACL tears or an individual who is not interested in a return to sport, surgical repair may not be considered and alternate rehabilitation programs may be employed. Penrith Panther Peter Wallace played 3 seasons without an ACL due to complications with his surgery. So the rehab goals, 0 to 3 weeks post-surgery, the main goal is establishing strength and range of motion. So they work on restoring knee extension and light muscle reactivation. So they'll go through some light quadricep and hamstring exercises. So the rehab goals for 3 to 12 weeks post-surgery are balance and control. So through these weeks, they focus on controlled strength building exercises, such as reintroducing compound lifts like the deadlifts, RDLs and squats. There's a big focus on restoring complete range of motion, and there's a big focus on improving the stability of the knee. So looking at the rehab goals for 3 to 6 months post-surgery are often functional training and an emphasis on mind-muscle connection. So there's a big emphasis on plyometric trainings, which is your jumping and your landing activities, an emphasis on return to straight line sprinting, and a light introduction of agility training. So the main focus from 6 to 12 months post-surgery is the return to sport. So there's a big focus on high-intensity resistance training, agility and plyometric training. There's an introduction of sports-specific movements and training, so that means returning to your normal sports without playing games, and ensuring symmetry within 10% of the uninjured knee to make sure that everything is reasonably equal. So looking at some advancements in ACL rehab, so many surgeons are now incorporating anterolateral reinforcement into their ACL reconstructions, which means that a second graft is used to make the new ACL stronger in rotational situations. There is currently lots of research into and development of artificial ligaments and synthetic grafts for ACL replacement, which would mean that the other areas of the body would not be affected by the reconstruction, like the hamstring and patellar tendon grafts. Many rehabilitation programs are becoming much more individualised to the athlete and their progress rather than sticking to the traditional outlined time-based approach. More non-surgical options are being studied, which could potentially lower the return to sport time, and more research is being done on preventative strategies. Having a quick look now at some athletes who have returned to the top of their sports after an ACL reconstruction. So Roger Tuivasa-Sheck, he won the Dally M, which is the best player in the NRL, after he had his ACL redone. James Tedesco won a few Daily M's after having his ACL torn. He's actually the current Daily M winner, and he actually tore his ACL in his first ever NRL debut game. Derrick Rose, he returned to the NBA after his ACL reconstruction, and he's gone on to probably play another 10 years. Klay Thompson is another well-known NBA player who has returned after his ACL tear. Adrian Peterson won an NFL MVP after he returned. Tom Brady won a few Super Bowls after he returned from his ACL repair, and Tiger Woods won the PGA in the same year that he actually tore his ACL. Simone Biles as well is an Olympic gymnast, and she won the gold medal after returning from her ACL tear.